Physical development, the main thing with adolescence and substance abuse is that they deal with everything that's going on with them through avoidance. If you feel uncomfortable, you just go out and use or drink. That I can't tell you how many kids I've had who their first, and sometimes all their sexual encounters have been while they've been under the influence. They have not been clean and sober for one single episode of sexual behavior. Now, they can't separate their sexual development from their substance abuse. It's very difficult for them. That instead of getting in touch with your physical self and feeling like you're in control of it, they've been using. They're not any more at peace with their body when they're 17 than they were when they were 14. Because becoming at peace with your body, just as becoming competent socially, requires that you be present and you go through some anxiety and discomfort with that. And they have not done that. They've not matured. They've avoided that whole concept. They've been involved in situations, actually physical situations that are humiliating for them. They're shame-based for them. They don't want to deal with. And when you take their drugs and alcohol away, that is there. That's in the forefront. So you get kids who are about 12 years old sometimes in terms of their sexual attitudes, understanding appropriate outlets for their sexual feelings, and just their whole sexual development. It's been so trauma-ridden. And I'm talking guys as well as girls. I can't tell you. I used to understand it when the girls would always talk with a great regret about some things that happened to them physically. But then the guys started talking with great regret about things that had happened to them as well, like saying, it would have really been nice if I wasn't in a blackout the first time I had sex. I kind of regret that had happened to me. So for them, the physical development, the psychosexual development, and their substance abuse has very hand in hand. We also know that particularly heavy marijuana use, particularly early on in adolescence with males, prevents the development or delays the development of secondary sex characteristics. So we get adolescents who really look like they're little kids, developmentally. Their shoulders are narrow. They still have little boy bodies, and that's a really good indication of chronic substance abuse. And I'm really worried because I have right now 10 7th graders that have been referred to me for substance abuse problems. 10. That's a lot of 7th graders. And so what we're seeing is we're really seeing kids in that early phase of adolescence become more and more involved with the use of particularly marijuana. And we know that's from a physical development phase a terrible thing. It's not appropriate for them to do that. It's not appropriate for them to use it at all, but it's really detrimental in terms of their development at that phase. And then they feel bad because when they quit smoking pot, their physical development has not kicked in, and they feel little or scrawny or weak. And then that's a problem because then they're uncomfortable with their physical self. So that whole process for kids just creates problems for them all along the way. The role of the family for the kids, this is very important. We talked about one of the primary roles developmentally for kids is that separating from the family, becoming competent and independent on my own, okay, knowing who I am, then coming back and reconnecting with adult culture. That's the process. Okay. Well, think about substance abusing kids. They never develop independence. They never develop competence. They know that they are not ready to take care of themselves. Their family knows they're not ready to take care of themselves, and we know they're not ready to take care of themselves. So substance abuse prevents the process of separation and individuation. Huge. That if you talk to a mother of an 18-year-old substance abuser or the father of an 18-year-old substance abuser, they will tell you, this kid can't take care of himself. We can't kick him out on the streets. He can't do anything right. And that kid will tell you, they won't kick me out. They know that I can't do anything right. So what happens is everybody, being a drug addict is a really good way to avoid independence. Because nobody in their right mind would expect you to function like an independent person. Everybody knows that you're a user, that you haven't been present for your adolescence. So it really messes up the process. Now, it guarantees mom a job for a while. If you have an 18-year-old who's a substance user, it guarantees mom that you're going to be able to be a mother for a while longer to that kid because that kid's not anywhere near movement away. So it really, really impedes that whole process of individuation and separation. And the earlier they start using drugs, the more behind they are in that process. It really gives the kid a safety net that people aren't going to expect competency out of them because they've not been present. They haven't gone to school. They haven't made independent choices. And in a lot of ways, I always laugh that when 18-year-old drug users start to get better, they almost always do something really stupid to get their mothers and dads and all the adults around them back involved with rescuing behavior. And that's because they're telling us through their actions that I know I'm not ready for this. Don't let go of me too soon here. So you can't treat them. The world might be saying you're 18 and you need to move forward. But it's real easy for people to stay stuck in that role of overdependence with them. So what basically happens is they have really prolonged dependencies on their families. It makes adolescence turbulent, but it doesn't facilitate the separation process. With adolescent turbulence, the whole payoff with that is that you get some separation here. So you don't get that payoff. It's turbulence without separation. So it makes the whole adolescent process kind of null and void. And you kind of have to start all over when they get clean and sober. What a waste of time and energy. That's terrible. These kids know they're incompetent to meet their needs. The other thing that's really sad is very often by the time the kids have moved through adolescence, the rift that's happened between the parents and the kids makes making peace almost impossible. Parents are so hurt, or family members have walked away, turned their back on the kid can't go back and do the peacemaking. Social development, many things happen with this. Number one, the kids learn that their primary relationship is not with an individual but with their drugs. Instead of working on developing people relationships, these kids develop relationships with their chemicals, and their chemicals become more important than anything else. And as a result of that, they're 17, they don't have relationship skills. They don't have people relationship skills. The other thing that happens is that in that early adolescent process, kids get ready to go to a social gathering. And what's real normal in early adolescence is to say, oh my gosh, no one's going to talk to me. This is going to be horrible. Be real uncomfortable with it. You go to the gathering, someone actually comes up and talks to you, and you say, oh, well, next time it'll be easier. And you develop confidence in yourself. Okay? What does a substance abuser kid do? They don't go anywhere unless they get stoned first, because they're so nervous about going to the party they use before they go. So once they go, they don't know if people talk to them because they liked them, or if people talk to them at all, or if people talk to them because they knew they're the ones that had the drugs. So what happens is they avoid all that uncomfortableness, but they never develop social competence. And it's so sad to talk to a 17-year-old kid in recovery who says, Janice, when I walk into the room, I don't know how to talk to people, and everybody else around me does. Why is that? And you say, because when you were supposed to be learning to talk to people in a social situation, you were getting stoned. And now they know and you don't. You're right. They're comfortable with it. They've been practicing it for 4 years, and you haven't. You're right. And now, but the good thing is social skills are things that you learn. Then you do what I call social skills 101. How do you start a conversation? How do you carry on? What do you not want to do so that you stop the conversation short? These kids socially, very awkward for them. All of a sudden they wake up, they're not stoned anymore. They realize that they are way behind in terms of just developing social competence. The other thing that happens from a social perspective is these kids are hanging with kids that they have subculture rules. Okay? They do things like rip each other off, steal each other's drugs, turn each other in. So the social rules that they've been operating by are not the social rules that the rest of the world operates by. So they not only are uncomfortable socially, they have all those subculture values that do not prepare them to function. And back to the word of empathy. They've not been working on that whole concept of empathy. There's some really weird rules. Okay, there's some kind of sense of loyalty and all that stuff, but not in a way that's going to work for them in the mainstream. So they really are focused on and influenced by drug culture values, and you guys have heard me talk about that tons of times, that whole culture of addiction stuff. These kids have been really impacted by that. They don't know anything beyond that. You put them in a mainstream environment, they're very uncomfortable, and they know they don't know how the rules operate. They also kind of stay stuck in that subculture and that immaturity. In the adolescent drug culture, the most pathological person continues to rule. So these kids, unlike healthy adolescents, continue to look up to the jerk from middle school. They continue to think. There's a guru, and it always kills me how there's these folk heroes in the subculture. There's a guru, this kid. He's got a really unusual name. I've heard about this kid for 4 years. I've got probably every girl he's ever dated has been in therapy with me. And I just thought he was going to be some huge monster kind of horrible guy. And so one of my kids says, you got to meet him. Anyway, he needs to talk to somebody. So he brings the kid in to see me. And I'm looking at this kid, and he is a big, huge 19-year-old kid who's a drug dealer, and he is like a 12-year-old. He's like a little, and I'm like, that's you? I was like so disappointed. I go, gosh, you're like a little geek guy. You're not even smart. You act like a little 12-year-old. I was just thinking in my mind, this is the legend? But then I think it doesn't take much to be a legend in a subculture, you know. I mean, it takes the fact that, you know, that you got the drugs and all this stuff. And I just felt so bad. Here I thought, you know, all this time I've been thinking, I'm like, get my hands on that guy. He's just messing. And here he's in there, and I'm like, oh, you pitiful little thing. And I said, you know, and he's like, I've been trying to get myself together, and it just doesn't work and doesn't work. I'm like, well, you know, maybe you need to see a therapist. You know, I'm like, he's going to be my client. He goes, will you talk to me? I'm like, oh, no, I knew this was going to happen, you know. I was like, well, why don't you give it some thought and call me back if you still want to do this tomorrow. So he never did call me back. But, you know, I meet this guy, and I'm thinking he's going to be this big, bad legend, and he's this, like, little kid who acts like he's, like, 12 years old. And everybody outside the subculture sees him that way. They see him as the kid from middle school. But to our kids in the subculture, they still look up to him, you know, which I guess somebody ought to look up to him. So they still look up to him. And most of the kids in the subculture that look up to him are younger than him. So they kind of stay stuck in that the most pathological person rules, which means when they come to you, that's what happens. The most pathological person in your environments are the ones that get all the status, unfortunately. They really kind of have not developed a really good self-image on the inside, so what they've done is they've really worked on their facades, their druggy facades, their gangster facades, all that type of stuff. The other thing that's real sad about these kids is they really, through their drug use, have developed these distorted perceptions. You know, and I always laugh that you can tell somebody's been involved in the drug culture because if you hold up a glass and it's got water in it, some kids say it's half full and some kids say it's half empty, and the druggy kids go, who stole the rest of my water? They have this really distortions about, hi, how you doing? How come you're always picking on me? They always want to do battle with you. They have these really, you know, weird distortions that really create just a lot of problems for them. And that's part of that whole social development impacted by the drug culture. False sense of achievement. False sense of achievement. They think they've done a lot when you know they haven't done anything. That's throughout this process. Emotional development. Kids don't learn to deal with their emotions. They medicate everything. Feel bad, get high. Feel good, get high. Feel angry, get high. I mean, they really don't learn that whole concept of, these are my feelings. I don't have to react to them. I can control them. I can make good decisions about them. They don't learn that. They learn that if you have an uncomfortable feeling, if you get high, it kind of takes it away. And the longer they do that, the more they keep their feelings at bay. They really are not there for you emotionally. I mean, they just are so used to medicating. So they get clean no matter what their age, and all their 12-year-old feelings come back. And they have about as much control over that as 12-year-olds do or 13-year-olds do, tend to react to it. And that's where you get what you see as the really immature behavior. They haven't been practicing controlling your emotions, learning to kind of put a stop between how you feel and how you act and think about that really requires a lot of years of practice. They haven't had any practice. So we get kids who, they're very emotional that way. They respond to what's going on. They tend to act out very much like young adolescents. They try and protect themselves from all these feelings. These feelings are uncomfortable for them. They're hard for them, so they try and protect themselves. And they protect themselves by blaming you, projecting. You can always tell a kid who thinks they're not trustworthy, because a kid who thinks he's not trustworthy is always saying to you, how come you don't trust me? Okay. A kid who thinks he's stupid will be saying to you all the time, you think I'm stupid, don't you? That's how they protect themselves from those feelings. And I just can't imagine. I always wonder, after all these years of being stoned and the kids that we take their drugs away and all these feelings start coming back, how crazy that must be for them. And that's why if you track the process of kids who are getting non-toxic, if you watch kids come off drugs, they're kind of like zombies. Okay? And then after they get done being zombies, they're crazy. They're like bouncing all over the place, and they're running around, and they're all these high-energy kids. And that's because all this stuff is coming back with them, and they don't have any skills about how to deal with that. So from an emotional point of view, they really they don't learn any management skills. They remain very, very immature. Academically, and this kind of goes with cognitive development, 90% of the times these kids are academically underachievers. They have real low energy levels in regards to school or job responsibility. Especially that whole concept of smoking pot, not caring, not having any energy, that amotivational syndrome. When you go through your entire high school years, I don't care how smart you are, and you've been doing that, you haven't, you're stoned before you go to class, you don't pick up, you don't learn, you're going to get behind academically. That low energy level creates an attitude of, I just do just enough to get by, I'm not going to do anything extra, I'm not going to go out on a limb here and work myself. So their ability to function academically is really impaired. There's probably so much potential from a cognitive point of view that they've not been able to achieve because of their use. But once again, they kind of stay stuck in this really little kid's world that anything's possible. Anybody can be a doctor. No, generally you have to graduate from high school before that's possible. And when you talk with drug-addicted kids, do you get that impression they're going to be these great things? I have a Ziggy cartoon, and the guy's sitting on the couch, and he's like, I'm going to do wonderful things. I'm going to win a Nobel Prize. He's going on and on and on. And at the bottom he goes, but first I have to get off the couch. And I have that blown up, and I have that on my wall for my pot addicts to look at. And I tell them all the time, you're so funny because you talk about all these wonderful things, but you don't do the first step to get there. And so I just put that up, and every one of them said, was that just for me? I go, yeah, I saw your name when I cut that out, because they're still narcissistic and self-centered. They think it's only for them. So that's just like what you were talking about last week. And that's how they are. They have all these aspirations, but they won't get off the couch. They haven't done anything to make movement towards those things happening. And it's almost as if it doesn't occur to them that they're supposed to do something to make it happen, that actually you're going to have to work for it. They have this whole drug-using attitude that this is boring. If it's boring, I shouldn't have to do it. They kind of remain stuck in that critical thinking phase. They don't ever kind of rejoin the adult culture. They continue to kind of say, this is stupid, this is dumb, way beyond when it's socially appropriate for them to do that. They kind of have an attitude of, I have an easier way. I can sell drugs as opposed to having to work, so why should I have to work? Don't have any kind of appreciation for the need to set goals and how it feels when you accomplish those goals. What happens to these kids when they're about 18 or 19, whenever the real world dictates that they get into this, they end up almost going into a panic because they're 18 or 19 and they know they're not anywhere near ready to face young adulthood, and it's real panicky for them. And sometimes that panic creates a flurry of activity where they're attempting to get on board with that, and sometimes that panic just freezes them. But I don't know a kid who's had a drug-addicted adolescence who did an easy transition into young adulthood, because they know that there are many, many pieces of their life that have been they don't have, things that they ought to have developmentally that they don't. So what we know is that when we work with kids, we really need to assess in all their areas, socially, academically, language skills, cognitively, with their family, where are they at? You really need to know with their family, because wherever they're at with their family, that's going to transfer right to you, okay, when you become the parental figure in their life. What can we do? What kind of treatment goals do we set in response to that? What do we know about substance abuse and how this particular kid's use impacted their development? How can we work with that? How can we teach the kids? And I have even talked to the kids about these are, from a goal perspective, these are things you ought to be able to learn to do a little bit more. And I use the developmental model with that. That someone your age you really need to work on learning how to do this. You didn't learn to do that because for whatever reason you were using drugs. So you and I were going to work on that a little bit. Like my kid who said to me, how come I go to a party can't talk? Well, because you have to learn to do that. That's one of your goals. You and I are going to work on doing that. So that's why we have to do with our kids skill development that allows them to work the 12-step program. They need all this stuff to even go work that program. So our job is to back it up and do skill development to even teach them the skills they have so they can even use the programs that we say are out there for them.